This video will help you best be supported at home after you've had your total hip or knee replacement. In this video, we will discuss pain management, prevention of blood clots, management of other medications, wound care, and physical therapy. Now let's talk about multimodal pain management at home. You should have a plan for up to 4 to 6 weeks of caring for your pain and swelling after surgery. There are 4 categories of medications that we will use to help you, including oral narcotics, anti-inflammatories, Tylenol, and nerve modification agents like Neurontin or Lyrica. Let's talk about narcotics. These, of course, are strong medications that do have the potential for abuse. That being said, they are important for use in the early stages of your recovery. Most patients have stopped using them by 4 weeks, but having both a long-acting and short-acting narcotic as prescribed by your surgical team is important for your pain relief during your recovery. Be sure to have these medications in hand or a plan to get them because they are controlled substances. Now let's talk about anti-inflammatories. These medications help with pain and swelling after surgery, and especially for knee replacements, help with you getting your range of motion. For hip replacements, they help with the formation of new bone and limit that formation so that your joint doesn't get stiff. Common medications are Celebrex as a prescription and ibuprofen or Aleve over the counter. Be sure to take what your surgical team has prescribed for you. Often these medications should be taken for more than 4 to 6 weeks after surgery. Now let's talk about Tylenol. This is an over-the-counter agent that's very common. When taken with other agents, it can be very helpful to help with your overall pain control. Be sure to take what your surgical team has recommended, but do not take more than 4 grams. This can be a toxic dose, but taking Tylenol split into 2, 3, or 4 doses during the day with other medications can be helpful. Last, let's talk about nerve modification agents such as Neurontin or Lyrica. These are used for nerve pain, and when taken in conjunction with other agents, if prescribed by your surgical team, can be helpful. Make sure to have a plan for multimodal pain control with your surgical team. This is what you will use at home for 4 to 6 weeks after surgery. Now let's talk about preventing lower extremity blood clots after getting a hip or knee replacement. It's important to understand that lower extremity blood clots, or DVTs, also known as deep venous thrombosis, can be life-threatening. The problem is that a blood clot that forms in the leg, which can happen after surgery, can travel to your lungs and make it difficult to breathe. So, we want to make sure that we do everything we can to prevent the formation of blood clots. By using the measures that I'm going to tell you about, it's very unlikely to have a life-threatening blood clot. So, it's important to know that the medications used can vary by surgeon, so make sure you have a plan with your surgical team. We often use injectable medications for 2 weeks, sometimes longer. Lovenox is a common medication, for instance. You would give this to yourself once or twice a day as directed by your surgical team and for 2 weeks and sometimes longer. This helps thin your blood and limit the progression of blood clots. Some surgeons do not use this type of medication but use an oral agent such as aspirin or Xarelto. At the end of the day, you must have a plan with your surgical team to help prevent blood clots, and you must have this medication at home. Now let's talk about other medications that can make your experience at home more comfortable. Remember that constipation and nausea are things that can happen after surgery, often due to your immobility and pain medication. The more mobile you are, however, the less these things should be a problem. Constipation regimens can vary and are really based on your preference. Miralax is one agent you can use to help with constipation, but you may also use home remedies that work for you. If you have significant nausea, it's important to talk with your surgical team to understand why you're nauseous. There are medications that can be used, that can be called in by your surgical team, but please communicate with your team to arrange this. It's important to understand that you may have changes in other medications when you leave the hospital. Blood pressure medications would be a common one. So understand what that plan is when you leave the hospital and make those changes as directed. After several weeks, you may also discuss with your primary care doctor what your final blood pressure regimen and other medications should be. Now let's talk about wound care while you're at home. When you leave the hospital after a total hip or knee procedure, you should be given a waterproof bandage that's applied to the front of your hip or the back of your hip, should your incision be there, or the front of your knee. For many people, this waterproof bandage will stay on your body until you see your doctor's team in about 10 to 14 days. It is important to understand that there can be issues with the bandage, whether it be peeling at the edge or some drainage. If that occurs, we ask that you get new bandages from the pharmacy or delivered to your home. A new bandage can be placed, but you should keep your incision clean and dry. Around 10 to 14 days, you should have a plan to see your surgical team for an examination of your wound and removal of any sutures if required. Often, absorbable sutures are used, but it's important that your surgical team is able to look at your incision. It's important to expect the unexpected in regards to your wound. Small amounts of drainage, things known as a stitch abscess, where you can get some slight redness around the incision, can actually be normal. But excessive bleeding, drainage, odor, or opening in your skin are things to look out for and are not normal. If you have any questions, be sure to call your surgical team to ask. Now let's talk about physical therapy at home. Many patients will have home physical therapy set up for a couple weeks at home after having a hip or knee replacement. This is for safety, but also to help with your mobilization. Gait training, or appropriate walking, is a very important activity whether after a total hip or knee replacement. Basic strengthening exercises and not going beyond the boundaries that your surgical team wants is also appropriate. For knee replacement patients in specific, range of motion of the knee is very important. This should be begun by your home physical therapist, but it's also important to set up outpatient physical therapy if your surgeon recommends it. It sometimes can take time to get an appointment, so be sure to arrange this in time. Let's talk about hip replacement precautions. After hip replacement, your surgical team may tell you to avoid particular movements or positions of your hip. Two categories would be anterior versus posterior precautions. Be sure to maintain these precautions that you will be taught while in the hospital and maintain them at home. One final comment. Be sure to expect ups and downs as you're rehabilitating. It's expected to have some good days and some bad days. And this is very true surrounding joint replacement. Some days may have more or less pain or more or less stiffness. Don't be discouraged. Things will come along, but please describe your experience to your surgical team during your postoperative visits. Thank you.